the likelihood of developing a bladder cancer or rectal cancer is slightly higher if you've had radiation therapy to your pelvis, to the prostate. And that's something that has come to light a little bit more in the last several years. Most radiation therapists mention it as a risk, and it's not a very high risk, but it is there. It's a little bit higher if you take 1,000 men who had radiation therapy to their prostate. The rate of bladder cancer development in those men will be a little bit higher, and rectal cancer. Is that enough of a reason not to do radiation therapy? I don't think so in appropriately selected people, but you just have to know that there are risks with all these different things that we do. That's just another one that you're taking on if you have radiation therapy.
And I've even had discussions with patients of mine who've had a diagnosis pre-existing their prostate cancer with bladder cancer as their diagnosis, and I've still had them go through courses of radiation therapy. And I have not, in 33 years, which is dating myself now, have seen increasing in their recurrence rates or their upstaging of their bladder cancer disease as a result of the radiation therapy.
I haven't
I was
been
worried
in,
for a moment.
Can I just tag on to that?
Sure.
I haven't been in practice as long as Dr. Lutz and Dr. Peabody.
She's younger is what she's trying to say.
Yeah, I'm much younger.
Rubbing it in.
But anecdotally, we do see patients pre-radiation, post-radiation for prevention of radiation side effects. And we find that using demulcent herbs that coat the bladder during radiations, those things like slippery elm, help to reduce the risk. And again, we're talking about 7 years anecdotal data, not 33. But also high-dose probiotics seem to help without competing with radiation dose. And we've used those widely in a hospital setting. Even though I've only been in practice for 7 years, I've seen over 7,000 patients, a large percentage of them prostate. So they seem to do well with demulcent herbs.